It's been a while since we've done this. Our team has changed a little bit, so we wanted to introduce everybody, and I'd like you to welcome to Pro Action Health and Performance, where we prevent injuries, we increase performance, and we speed up recovery times. At Pro Action Health and Performance, our mission is to help every patient prevent injury, perform at their best, and to recover with confidence. We are a multidisciplinary team devoted to accurate diagnosis, personalized treatment plans, and collaborative care. Our goal today is to introduce you to our team, explain the treatments we offer, and highlight the benefits these services provide for a wide range of conditions. I'm Doc Hockey, and just a little summary. We do sports and occupational injuries, concussions. We have geriatrics patients that deal with arthritis, exercise programs, nutrition programs, etc. Our clinic philosophy and approach. We are focused at the root cause of our pain and injury, not just the symptoms. Our team collaborates closely with each other with evidence-based therapies and ongoing education that every patient gets the right treatment for their individual needs. We emphasize education, ensuring that all patients understand their diagnosis, treatment, and options and recovery plans. One case study I can think about that really zeroes in on not just doing what the symptoms are, not just treating the symptoms, is sometimes our nerve entrapment causing heel pain. So we had a patient recently come in. She had a whole bunch of heel pain. We pushed on the heel, put pressure on it. Nothing was really eliciting that pain. We found out later on that when she's walking on her toes, the pain was much more substantial. We look at the calf where the nerve was related to it, on and up to the sciatic nerve. As we started to break down the adhesions in the sciatic nerve, the nerve became less tensionized, putting less pressure on the heel because it was able to let go of those calf muscles as well as the Achilles tendon, which put a lot less pressure from the tendon in the calf. And it helped her heal up a lot quicker, where we wouldn't have found that diagnosis, and she was seeing somebody else for several months before us. And now we're starting to make a lot of headway, and she's been doing really, really well. Our chiropractic care practitioners, we have myself here, Shane Bayless. We have Dr. Andrew Crepin and Jennifer Jaros. Our chiropractors specialize in diagnosing and treating conditions related to the spine, joints, musculoskeletal system, and through a variety of soft tissue therapies and manual adjustments that we use, we often restore alignment, reduce pain, and improve overall strength and function. Chiropractic care is effective for conditions not just back and neck and headache pains or even joint dysfunctions, but also our related sports injuries, as well as all joints in the body, which we often have to tell our patients over and over again that we do more than just necks and backs. And even down here, our Dr. Jennifer Jaros, she even does animals. She does bracing, physiotherapy, chiropractic, and acupuncture with dogs, cats, and mostly horses as well. But don't get me wrong, she doesn't bring the horses into the clinic, but she does travel around to barns and does that as well. So she is a wealth of knowledge when it comes to animal chiropractic. Our physiotherapist services and practitioners here, we have Bavika, who is up here. We have Neha, who's down there, and Nidhi or Nidibin. Our physiotherapists are focused on restoring and maintaining physical mobility, strength, and function. Our physiotherapists can help with recovery after injury, surgery, or chronic conditions. All of them employ acupuncture, which is dry needling. It can be just motor points. It can be Chinese acupuncture as well. Down here in Neha, she does our pelvic floor and GLAD programs. And those are really great programs that you might want to ask about more questions about that because they can really help with stabilization and help with those painful joints. Our naturopathic medicine practitioner, Dr. Ann Lawrence, she uses our health journey from a holistic perspective. She has over 20 years of experience helping patients of all ages. She uses nutrition counseling, botanical medicine, and homeopathy, or homeopathy, whatever people want to pronounce it, acupuncture, Bowen therapy. She does lab testing with blood work, hair analysis, food intolerance testing. This approach helps with digestive issues, detoxification, immune support, and overall well-being. One thing I like about Anne so much is that she really takes a perspective of let's clean up the lifestyle first and see what we're left with after that, and then we'll incorporate possibly supplements or pills if we need them. to help out your condition to make sure we get over those hurdles when, sometimes hormones aren't acting right or the body is not digesting or breaking down things properly. So she's really great for that. I've used it with my son and myself, and she's just a wealth of knowledge from a nutritional perspective. Our massage therapist is Fernaz. She's been in the massage clinic and massage therapy realm for about 11 years now. She was 2 years as a physiotherapist assistant, which gives her a wealth of knowledge in exercise and rehab. So she's often giving some of our patients rehab exercise, which correlates with what we're doing with them if we're co-treating at the same time. She does manipulation of muscles, soft tissues. She reduces pain, relieves tension, and improves circulation with her techniques. Her techniques have evolved from a deep tissue sports massage, which many of our bodybuilders or sports people often are, saying that they're trying to hold on without having to, tap out. But she does a great job with even relaxation because I know my mother-in-law and my wife also has taken her, and they like more of relaxation massage, and I like deep tissue. So she really fits both of them. I haven't had any complaints on either way, and she's really good at adjusting her pressures to fit the patient's needs. I know as well, she's been great with our kids as going through different stresses from sports to just anxiety. So she's been able to help them with those types of things as well. She's just a really a great person to have on our staff. She also is not one of those massage therapists where you have to go in there and talk the whole time. She goes and asks you questions at the beginning for your history, and after that, it's kind of like if she's asked a question, she'll answer it or talk it when talked to. She's not one to always have to question you. So if you feel like you just want to relax and feel the massage and get into your own self, she lets you kind of do that, which is a great advantage to having a massage therapist working with you. So our technologies and techniques, our clinic uses a variety of different treatments. You maybe know of a lot of them. So active release technique in Graston is for soft tissue breakdown and soft tissue reorganization. We use the shockwave therapy to help deep penetration of scar tissue that might be in deeper joints like hips and knees. It often used with tendons to break down Achilles tendons adhesions, especially when you get tendonitis or tendinosis. And it really just helps out with reducing that chronic pain that might have been there for a long time where the tissues got really stiff or leathery. We have medical acupuncture as well to reduce pain and regain strength and support recovery. We talked about the different acupunctures that we have, motor points, Chinese medicine, as well as dry needling. We use a class 4 laser therapy, which is not that well known in Ottawa. It has a lot of increased in pressure and stimulation to the cells, which means we can use less treatment time, where a lot of them have to leave the treatment on you for about 30 minutes with using lower class like 2Bs or 3B lasers. So this has a 4 wavelength laser, which hits on different cell types. It accelerates the cell energy, so it increases the cell energy so that lymphatic system, circulation, and immune system are all functioning at a higher rate, which just helps clear up inflammation and restores cell function. Kinesiotaping and therapeutic exercise. We're using those constantly to help with biomechanics and decrease pain, as well as to help move some circulation in the area, because we all know that exercise helps with contracting those veins to get the toxins out. And we know the kinesiotape can help move the skin on top so the tissue is moving underneath, which creates more blood flow. Concussion management and treatment. We treat a lot of different things. We have baseline testing. We use VOG goggles to see the eye movement and ocular movements. We use NeuroTracker to see how your vision is working from a perspective of peripheral vision, as well as tracking. We use Next Level, which is a neck rehabilitation exercise machine that helps you increase strength with rotation, forward and back flexion. And acute and chronic persistent symptoms. We also treat all those different types of patients. So if it just got hit yesterday, or if you've been dealing with it for 2 to 3 years, we have those principles that we use to help each individual on if they're on an acute route or a chronic and persistent route. Functional neurology is one of our principles that we use. This has been something that has been known since Sidney Crosby has made his way back into hockey. Dr. Carrick was the one using functional neurology with him, which really helped him get back on board with his Hall of Fame career that he is doing at this moment. GLAD program, we talked about knee and hip arthritis for usually elderly patients or anyone that's had just knee problems growing up, might have been from the sports injuries or not, where they're having osteoarthritis and they're limiting their range of motion and they're in a lot of pain, which sometimes they're seeking like a hip replacement or a knee replacement from these programs. And it's an approved, accredited program from Denmark, which they do surveys and testing that we have to keep sending in to make sure that we're doing the program properly and we're getting the results that they expect. We get all our referrals from usually sports clinics and the hospitals for this type of program. So we treat a wide variety of conditions, not just your necks and backs and headaches and joint pain. We have sports injuries, sprains, strains. We use the laser for those big inflammation into the swelling of the ankles and things. Osgood Slaughters for the growing pains, shoulder separations, dislocations, mostly seen with our hockey players and sports athletes. We have muscle tears, meniscus and ligament tears and strains. So we cover all of those. Occupational injuries like tennis elbow and golfer's elbow. I know those things don't sound like occupational injuries, but they happen with all that typing, carpal tunnel, finger injuries, posture ergonomic issues. Some of the most common injuries, plantar fasciosis or plantar fasciitis, ITB syndrome, jumper's knee, nerve entrapments that we talked about earlier, sciatic nerve, median nerve, tibial nerve, ulnar nerve, radial nerve, all those different types of nerves that you might get entrapped and cause lanciating pain down the arms or legs. We have post-surgical rehabilitation, which we're doing an ACL reconstruction rehabilitation right now with one of our soccer players. Concussions, we deal with the vision therapy, the vestibular therapy, your autonomic nervous system, so the way the heart is regulated during exercise, headache, and head and neck injuries like whiplash and motor vehicle accidents. Chronic conditions such as osteoarthritis with our GLAD program. And we're just here to functionally get people mobility better and performance better because some people just come in here to maintain their activity level so that they can play with their kids, play the sport that they love, and just continue with everyday activities. Patient benefits, we see a reduction in pain and inflammation, improved mobility and function, faster recoveries, personalized plans tailored to goals and lifestyles, education and tools to prevent future issues. And our collaborator team ensures patients receive comprehensive care that fits their lifestyles. So we're asking them to do things that they're able to do as well as that they're enjoying to do. Testimonials from and real results. We value all our patients' feedback. We had over 180 five-star reviews, which we're very proud of. Our patients love to share, and we love to share it with others as well. And hopefully, those that have maybe not has been as successful at other clinics, they won't give up and keep looking for that right clinic that actually fits them. So we love our testimonials that we get, and you can check us out on Google Maps and some of those other review stations where you can find reviews for clinics. And we'd love to hear feedback from everybody, good and bad, because it makes us better overall as a clinic and as practitioners. So if you're ready to get started or want to learn more, you can reach us here at the clinic at 308 Palladium Drive, Suite 108 in Canada. You can call us at 613-505-5000. Our website is proactionsportsclinic.com. Our email is proactionsportsclinic@gmail.com. And we're here to help prevent and improve performance so you can have a stronger recovery. Thank you for your time. If you have any questions, feel free to ask now, and we'd love to hear back from you. You can even leave a comment at the bottom if it works, and we'll get back to you as best as we can. So if you needed some help, give us a call, and we'll talk to you soon. Thanks again for your time. Take care.